Today was one of the most challenging days in clinic. I don't like to say bad. It was challenging. I've been working for 10 years. I had 3 residents today. It was so busy, but beyond being busy, it's just the complicated patients. And just to see a system that doesn't support patients is so hard as a pediatrician or as any clinician. And knowing that I don't have hours to talk to them because I have so many patients waiting, I hate the system so much. And there's so many things that irritate me, but today one of the big themes was the lack of mental health access and the lack of resources for neurodiverse children. And those 2 things really kill me, and those 2 things can happen for the same family because we know neurodiverse children are more prone to mental health issues. It was just a day. And, I don't have an answer. I'm just saying that it's a day, and maybe you have felt this on the other side, but it is hard being a patient and being a doctor right now. What's so hard also is that as pediatricians, you go into this because you really love kids. You think that you can make a difference upstream in childhood and you can do preventative medicine, and you go into it with those bright eyes, bushy tail. And I see that in my residents, and I'm so happy for them. But I also know that the system is just full of shit. Like the insurance, the reimbursement, all of that, the fact that we can't have time, and like I'm fighting for prior authorizations for medications, and then nothing's in network for families to see a psychologist or psychiatrist, and that psychologist or psychiatrist doesn't even know how to do all those things that I want them to do. Like the parents are afraid that their kids are going to get pumped up on meds. Like this entire system doesn't want preventative medicine because we do not have the time for it. And it kills me every day that I work, and every day I see it and I just get demoralized because I know there's a better way. I often find myself saying I'm sorry to my patients, and I'm sorry because you just want to help them. You want to be able to fix the problem. And a lot of it is on the family to figure out, but a lot of them don't have the resources. And then a lot of them with the insurance companies and coverage and who's in network, they've been just jumping from doctor or psychiatrist or psychologist or whatever who's not giving them answers. And the solution to me is more time, more prevention, more discussion of prevention, more discussion of coping skills and mindfulness and all these things, but then we just put on Band-Aids. It's always Band-Aids and not actual prevention. And even in pediatrics, I see it, and it kills me every day I come to the office because this is not how it should be. And this is not why I went into pediatrics. Like, we should really be able to have these long conversations, to really prevent and to really give these solutions so that parents aren't feeling stuck. So many of you watching this are my followers, and you appreciate pediatricians because that's why you follow a pediatrician. Maybe you've had positive experiences, but then I think of so many people in this world, and especially in this country, that do not have positive experience with their pediatricians. And I know for the most part, it's not the doctor. Like, yes, there are some bad eggs. Don't get me wrong. There are some. I've seen them. I've worked with them. But by and large, it's the lack of time. It's the fact that the system has really prioritized treatment and not prevention, Band-Aids and not actual time to talk about these issues. I could sit and have an entire conversation about nutrition and about emotional regulation and skills and coping skills and all of that, but I can't. And great, that means I use my resources, which is referrals. But then they're waiting for months to see these people because their insurance doesn't cover it or whatever. And it's just a vicious cycle, and it kills me. I'm just really worried about the future of pediatrics. Not only from the fact that pediatricians were already struggling to survive. I've been talking to a lot of colleagues. A lot of pediatric offices are being taken over by private equity. And when private equity gets involved, it can mean less quality because they care about bottom line and they care about metrics and all of that. And then so the mom and pop feel is gone. So now what I'm seeing is that it's either going to be a big box shop or a DPC, which is direct primary care, which means that if you have money and can pay people that direct primary care fee, you can get that quality, that time, which is wonderful. But then what about people who can't afford that? They're going to have to go to this big box clinic that doesn't have the time for them. And it's just putting Band-Aids. That's not fair. Like, it's so sad and so disgusting to me the way this is going. And then you add on the social media rhetoric demeaning pediatricians, saying that we're in it for the money and that we're horrible, we don't know anything about anything. What the fuck is happening? Like, it's not fair to our profession, and I'm sad. So if you're watching this and you love a pediatrician, Tell them that you appreciate them, number one, or any healthcare professional, anyone who's in the health capacity, or anyone at all. Spread love, okay? Just spread love, spread joy. That's what we need. And then if you've ever had a negative experience with a pediatrician, you're like, I don't like them, they're da-da-da, please just listen to what I said. Please think about the fact that there are other systemic issues that make it hard for them to do the job that they maybe want to do and they can't do. Because I have to believe that's true. And that's what kills me every day. But I hope that I can continue to show up here and give you these resources and have this incredible platform with this amazing growing community so that we can continue to learn and grow outside of doctors' offices. Because this is how I change the world if I can't change it in offices.